Millions of people around the world experience sudden, severe headaches and dizziness that can make even simple daily activities feel impossible. Imagine waking up in the morning, and before you can even start your day, a throbbing headache hits. Lights feel painfully bright, sounds seem unbearable, and the room seems to spin as if you are on a boat in rough waters. For many, these symptoms are part of a condition called migraine, a neurological disorder that can strike unpredictably and affect people several times every month, disrupting work, family life, and social activities. In addition, some individuals suffer from vertigo, a condition that causes a persistent spinning sensation even while standing still or lying down, making everyday tasks like walking, climbing stairs, or even turning your head feel risky and disorienting. To help manage these symptoms, doctors often prescribe a medicine called Flunarizine, which has been widely used in many countries for decades to prevent migraine attacks and reduce the spinning sensations associated with vertigo. Flunarizine does not work like a regular painkiller that simply stops a headache once it begins. Instead, it is taken regularly as a preventive medicine to reduce the frequency of migraines and help patients regain control over their daily lives. It belongs to a class of drugs known as calcium channel blockers, which work by regulating how calcium moves into nerve cells in the brain. Calcium is essential for the proper transmission of electrical and chemical signals between brain cells, and when these signals become unstable or overactive, they can trigger migraine attacks or contribute to balance problems such as vertigo. By controlling calcium entry into the nerve cells, flunarizine helps calm abnormal nerve activity and stabilizes communication in the brain, reducing the likelihood of migraine attacks and helping to control dizziness. Some studies also suggest that it improves blood flow in certain areas of the brain, providing an added protective effect, which is one of the reasons doctors consider it highly effective for long-term prevention. Migraines are far more than just bad headaches. They can be intensely disabling, leaving sufferers unable to work, exercise, or even socialize. Some people experience migraines that last for several hours or even days, accompanied by nausea, sensitivity to light and sound, blurred vision, or a throbbing pain on one side of the head. When these attacks happen multiple times every month, life can feel unpredictable and exhausting. Vertigo adds an additional layer of challenge, making movement feel risky and increasing the risk of falls. For these patients, flunarizine offers relief by preventing attacks before they occur. Many patients report noticeable improvements within a few weeks of starting the medicine, with reduced frequency and intensity of migraines and better control over balance and dizziness. Doctors often prescribe it when migraines or vertigo symptoms are frequent enough to interfere with daily life, making it a preventive rather than a reactive solution. Its dual ability to treat migraines and vertigo makes it a versatile medication, helping millions of patients feel more stable, alert, and able to manage their everyday responsibilities. Understanding how flunarizine works requires a brief look into the brain's complex communication system. The brain is like a massive network of billions of interconnected nerve cells constantly sending electrical and chemical signals. These signals control everything from movement and balance to sensations of pain and light. Calcium plays a key role in this process, acting as a critical messenger that allows nerve cells to transmit signals efficiently. However, when too much calcium enters the nerve cells, these signals can become unstable or overactive, which can trigger migraine attacks or worsen dizziness in vertigo patients. Flunarizine works by reducing the amount of calcium that enters the nerve cells, calming overactive nerves and stabilizing communication throughout the brain. This helps prevent the abnormal firing that can lead to migraines and vertigo episodes. Some research also indicates that flunarizine may improve blood flow to certain regions of the brain, providing additional support to nerve cells and enhancing overall brain stability. Through these mechanisms, the medicine allows patients to experience fewer migraine attacks, less severe headaches, and improved balance over time, giving them more control over their daily lives and reducing the unpredictability caused by these neurological conditions. Taking the correct dose of flunarizine is extremely important to ensure effectiveness while minimizing side effects. Doctors usually start patients on a low dose, commonly 5 mg per day, taken in the evening to reduce daytime drowsiness, one of the most common side effects. For patients with more severe symptoms, the dose may be gradually increased to 10 mg per day under careful medical supervision. Elderly patients, or those with other medical conditions, often receive lower doses to reduce the risk of side effects, and it is critical that patients never adjust the dose on their own. Stopping the medication suddenly is also discouraged, especially after long-term use, as the brain needs time to readjust. Following the prescribed dosage plan ensures that flunarizine provides the maximum benefit in preventing migraines and controlling vertigo, while reducing the likelihood of unwanted effects. Many patients notice improvement in their symptoms after a few weeks of consistent use, and adherence to the dosing schedule is often key to achieving the best results. Like all medicines, flunarizine comes with potential side effects. Many patients tolerate it well, but some experience mild symptoms that usually appear gradually. The most common side effects include sleepiness, fatigue, increased appetite, and gradual weight gain. Sleepiness occurs because the medicine slows certain brain activities, which is why taking it in the evening is often recommended. Fatigue and a general feeling of low energy can also occur during the day, particularly in the first few weeks. Increased appetite can lead to gradual weight gain over time. While these side effects are generally manageable, long-term use requires monitoring, as some effects may become more noticeable over months of continuous treatment. Despite these potential downsides, the benefits of preventing disabling migraines and controlling vertigo often outweigh the mild side effects for most patients, allowing them to lead more normal, productive lives. However, there is a lesser-known but important risk associated with flunarizine. In rare cases, long-term use of the medication can affect dopamine activity in the brain, which is essential for smooth and coordinated body movements. Dopamine acts as a chemical messenger that allows different parts of the brain to communicate effectively when walking, moving the hands, or maintaining balance. Disruption of dopamine signaling can lead to symptoms similar to those seen in Parkinson's disease. These symptoms may include slowed movements, muscle stiffness, and slight hand tremors. This condition is known as drug-induced Parkinsonism and is different from true Parkinson's disease because the symptoms are caused by the medication and often improve once the medicine is stopped or adjusted. Awareness of this risk is crucial, particularly for patients who take flunarizine for extended periods or have other vulnerabilities. Not everyone taking flunarizine will experience movement-related side effects. Most patients tolerate the medicine well when it is used under medical supervision. However, certain groups are more vulnerable. Older adults are more sensitive to changes in brain chemicals, which may increase their risk. Patients taking the medicine for many months or years are also more likely to develop symptoms. Individuals with a history of depression or other mood disorders may respond differently to medications that influence brain signaling, and some people naturally have higher sensitivity to dopamine changes. Doctors typically evaluate each patient carefully, considering age, medical history, and risk factors before prescribing flunarizine, and they may schedule regular follow-ups to monitor for early signs of movement issues. Patients taking flunarizine should pay attention to any unusual symptoms. A slight tremor in the hands, stiffness in the muscles, slower movement, or difficulties with coordination are warning signs that should not be ignored. Mood changes, unusual fatigue, or lack of motivation may also appear. Early detection is critical because, in many cases, symptoms improve once the medication is adjusted or discontinued. Regular checkups and open communication with a healthcare provider help ensure that the medicine continues to provide benefits while minimizing risks. Patients should never start, stop, or change the dose of flunarizine without consulting their doctor. Flunarizine is a medicine that can dramatically improve the quality of life for people suffering from frequent migraines and vertigo. It prevents migraine attacks before they start, reduces dizziness, and helps patients regain control over daily activities that were once challenging or impossible. At the same time, it carries potential risks that should not be overlooked, particularly movement-related side effects resembling Parkinson's disease in some individuals. The key is awareness and proper medical supervision. When used responsibly and monitored carefully, the benefits of flunarizine often outweigh the risks. Patients should follow their doctor's instructions closely, report any unusual symptoms, and maintain regular checkups to ensure the medicine is safe and effective. By understanding both the advantages and potential risks, patients can make informed decisions, protect their long-term health, and live life with fewer migraines, less dizziness, and greater confidence in their daily activities.